At the beginning of January this year in 2024, he began having some wounds on his leg, both the right and the left leg. So we sought medical assistance in Nairobi. So when we visited one of the hospitals in Nairobi, we were given a wound specialist who would come to the house alternating days to clean up the wounds. But the wounds got worse. So we had to go back to hospital, and we were told that we may need to see a vascular surgeon. So we started trying to get good vascular surgeons in Kenya. Unfortunately, some days after we were told that, on his right leg, he developed some pus, and it happened so rapidly. So when he was taken to hospital, they had to amputate his right leg. So later on, we were told that we need also to see a vascular surgeon who will be able to help this other leg, his left leg, so that it does not get amputated. So we started doing our research. So we contacted SPARSH Hospital, and they were very kind to us. They introduced us to a doctor called Dr. Naveen. So we had Zoom calls with Dr. Naveen around 3 times whilst we were in Nairobi. We had to make very, very quick plans because you can see the leg had already been amputated. So we planned and got flights and got the hospital, and we were able to travel here. And Dad was able to undergo surgery. Dr. Naveen was in charge of that group. There were around 6 doctors, I think, in theatre, and they did a tremendous job. And they were able to save this other leg so that it does not get amputated. The problem was actually the veins on both legs. The veins were clogged, so there was no blood flow to the feet.
Weeks ago, we treated an elderly patient from Kenya who has blocked major blood vessel in both legs, in the thigh and below knee region. He was suffering from severe pain, multiple ulcers in both legs, and they got infected and a gangrene was set in. He underwent below knee amputation of the right leg in Kenya. He was also advised amputation of his left leg. Then the patient travelled to India for this advanced treatment. He underwent a balloon angioplasty, which is a very minimally invasive technique. By a keyhole, we take access into the blood vessel, and our team was successfully able to recanalize the blood vessel and restore the blood supply to the leg. Post procedure, the ulcer started healing, and we could able to save his left leg. So this highlights a advanced minimally invasive technique which gives new hope to a patient with critical vascular condition.
The wounds now, they are healing very well. They've shrunk so fast, we cannot even believe how well they are healing. And Dad is happy. And now there's a lot of blood flow. He's even feeling much better than he was when we came. So we are very thankful to the hospital, to the team. I would recommend SPARSH Hospital to anyone across the world, not just in India, because we've come all the way from Africa, Kenya to be specific, and we've got very good treatment here, so we are very thankful.